Hi, Governor. I want to talk about testing. So it's my understanding that California has a testing backlog of somewhere around 59 or 60,000 tests that we just haven't yet processed. And yesterday, LA's county health director was saying that some people are waiting up to 12 days for the results. So what are some of the specific things that we're doing to reduce this backlog as we ramp up testing? You know, are we adding capacity to analyze tests? How are we making sure that this backlog doesn't just grow as we ramp up testing? And further, has the state sent guidelines to counties about what data they should be collecting and sharing with the public when it comes to testing?
Well, very, very specific guidelines have been sent out to the counties some time ago, not just the counties. I'll remind you there's really 4 buckets of testing in the state of California. You have academic institutions that are testing. You have the state labs that are testing. You have the commercial labs that are testing. And then you have all of these private sector point of care labs that are popping up everywhere. And so we have sent out detailed requests that not only we get the number of positives once those diagnostic results come back, but the number of negatives. We had protocols in the past where the commercial labs and others were only providing certain information, not the totality of the information. And that's why, as you know well, a few weeks ago, we've been very transparent about this. We said those numbers would change, and they did. You're correct. It's 59,500 test results are still pending. This is a national problem. Just one lab in the United States has over 100,000+ backlogged tests. Those large commercial labs are overwhelmed by the demand. And you know, you talk about LabCorp and Quest. This is what they do 24/7. Even this moment is overwhelming for them. Here's the good news. Every day we're increasing the number of tests that are being conducted. But we do recognize the time to delay. Yesterday, I mentioned up to 12 days, so I've heard that the day before. We had heard up to 8 to 10 days. The backlogs are not necessarily getting better in real time, but we're hopeful as these protocols and procedures and the new serology tests, those are the blood-based tests that look for proteins related to your immune system and antibodies, begin to supplement just the PCR tests, which are the dominant tests that have current backlog, that will be able to substantially fast-track those test results. Let me add to that as specific. You know, because I think we've all written about it, Abbott announced their testing capacity, 5 to 15 minutes to get back results. Those are point-of-care tests. But I want to caution people. The state of California received only 100 cassettes, 15 different lab sets. Do the math. I mean, it's an irrelevant, or rather, no, it's relevant to the individual. It's an insignificant total amount of tests that we can produce in 5 to 15 minutes in the state of California. So before people rush to, well, what about this I read about, or what about that? It's all about scale, and the scale is impacted not just by the time for diagnostics, but it's also impacted by the ability to get the samples. That's swabs, that's the media, and still, it's about reagents, the RNA extraction. That's the PCR test that finds the RNA virus in the nasal cavity. And you need the extraction kit, which is part of the reagents. Those supplies also continue to be scarce for many. So that could sound very confusing, but I hope it gives you a sense of the totality of what we are looking to organize more deliberately around in terms of our testing regimes. And know we have a new task force on tests, and in the next couple days, we're going to provide some, I think, very good news about our capacity to substantially increase our tests in the state of California. There's a reason I spoke about serology, blood-based tests, and the PCR tests in these labs in academia. We have a remarkable collection of individuals now advising us to get to the next level, which we think potentially could be best in class from even an international perspective, not just a national perspective, in terms of improving the time to diagnostics and the ability to get more samples and to provide the appropriate level of supplies, including PPE.